hands around the pot, James, and don't spare the horses.
All aboard!
It's showtime.
Yep, toot toot, all aboard. Here we go. It's On the Ledge, your Ontario Politics podcast. Dave Trafford here with you. And as we record this, it is just before 9 a.m. on Thursday, February the 19th. Thursdays are always a big day at my house. First, it's garbage day. Second, it is my evening out with the old boys at the Galway jamming. Of course, there's On the Ledge, but today it will be the Canada-U.S. women's gold medal game. I'm not really confident about coming away with the gold, but it'll be a good hockey anyway. So lots to get to, lots to talk to and talk about as we get around the table. All right, let's get to it. Here he is, our political analyst from Nova Scotia this morning, but you hear him and see him on CHTV. Keith Leslie is here. John Wright is the CEO at Canada Pulse Insights. Kathleen Wynne is the former Premier of Ontario. And Tim Hudak joining us. He is the former PC leader, and it looks like from the offices of Council Public Affairs. Sorry, I'm just stumbling all over the place here. Good morning, Tim.
Good morning. Yep, I'm at the HQ. Got a great view in there behind me. Sorry that I obscure it.
Oh, well, it just provides this halo effect for those of you watching on
I need the help.
On YouTube. There's lots we want to get to today. So, and one of the things, it wasn't really on the agenda until sort of last minute for me, but it was a story that has its roots last month. This came up in January, and we only started talking about it this week. And that was an appearance by the finance minister, Bethlenfalvy, at the Mississauga Board of Trade. It was January the 14th when he made these comments.
Our healthcare spending is unsustainable. We just have to deal with reality that we can't keep spending, particularly when our population is flattening.
And it's a very provocative statement. It garnered all kinds of attention, Keith. But you know what struck me is that nobody picked it up in the media until this week. That's a month-old story. We let that float. We let that just sort off the side of the desk. Nobody was paying attention to what the finance minister was saying.
Well, this is what you get with a downsized and shrinking media, isn't it? I mean, the media landscape has changed so much. There was a time when the finance minister giving a major address like that to a business group anywhere within the GTA would have had a good chunk of the Queen's Park Press Gallery there and probably some business reporters as well. The fact that this went that long unreported is a shame on all of us. As I say, it's very much a tale of what's going on in the media right now. They have to pick and choose where they go, when they go, what they can actually physically go cover. A lot of things are done by live stream now, so I don't know if this was on the live stream. I suspect it was. So it means no one even took the time to monitor this speech by the finance minister, where he said, as you said, some pretty cautious words, some very damning words, really, that healthcare spending at over $90 billion is unsustainable. Well, then he quickly said, that doesn't mean we're looking to make cuts in healthcare spending. Well, what does it mean then? Where are we going to go if the healthcare spending has become unsustainable? And just a few years ago, it was $60 billion. Now it's $90 billion. And this is before the big gray wave actually hits the healthcare system. So where are we going with this? As I say, a bit of a shame on the media, but this is still a very dire warning from the finance minister, and it's surprising that it took this long to actually hit home and have people talking about it.
Well, I think what we'll get to is some of the outcomes and what are the next steps in terms of what this actually means. But Kathleen Wynne, I watched the whole speech on YouTube, and it was streamed, Keith, so people could have watched it. I watched the whole speech, and it was about a 45 or 48 minute presentation all in. And given the dire tone of that 11-second clip, the finance minister only said the word healthcare 4 times. And one time he repeated himself getting into that clip. So if it were it just strikes me as, wow, we are really underplaying the state of healthcare in this province.
Yeah, and he doesn't really want to talk about it, Dave. I mean, he put it in the speech, but he doesn't really want to have an in-depth conversation about what that means. There's a bit of a foreshadowing of what they think they're going to have to do in the budget. But there's been a lot going on, and that's to the benefit of this government, that there's been a lot of distraction. And, I think it's interesting if healthcare costs are rising at a level of 6% a year, which is consistent with what we were dealing with in the 2016, 2017. That's the kind of increases that we were seeing, and he was projecting a 0.5% increase, which is just totally unrealistic. There's a real gap between what he knew was going on and his aspiration for what he could hold the budget to. So I think he's got some very tough days ahead in terms of laying out what they're going to do in the budget. He can say that there aren't going to be cuts in healthcare, but if he tries to constrain the healthcare budget to a 1% increase, for example, you will hear howls from not just hospitals, but from the system across the province, because that will mean essentially there will be cuts that will have to happen in every part of the sector. So I think that we are, I think we're facing a real challenge, not just in long-term care and home care because of the aging demographic, but across the system, particularly in terms of people's ability to find primary care physicians, which, if they can, saves the system money because there's a navigator for people through the system. And if that doesn't happen quickly, that whatever the 7% of people or 8% of people across the province who don't have a family care physician, if they don't get that, then I think we're looking at continued increases in the system. And he's going to have a fight on his hands. That's what I think is absolutely inevitable if he stays on this path.
Tim, we're still trying to patch up the old jalopy based on your metaphor of the healthcare system here. But here, the context of his comments, though, come against the backdrop of him sort of laying out, the finance minister, that is, laying out the dire circumstances globally of the economy, how slowly our economy is going to grow in the coming year based on his projections. He points out our population growth is flattening. It's getting older, so it's getting more difficult to have a tax base that can sustain what we're doing. There's a whole lot of worms in this can all of a sudden that make it all the more complicated to keep this thing on the rails.
Yeah. I mean, the Premier Wynne's right. You could do a lot more on primary care reform. I think Jane Philpott has been a great avenue for the province to do that. We do work for the Ontario Medical Association. They put very good ideas on the table to get more docs trained. The province has responded, attaching more patients to doctors' practices, a lot of progress. Because if you don't, right, then they start presenting themselves down the road with acute problems or critical illnesses, and it drives up costs. But I will still make that point that you can patch up this jalopy, this old used car, he puts more gas in the tank, but eventually it goes on the side of the road again. Two things happening here. That was Minister Bethlenfalvy's inside voice on the stage. This is a regular discussion around the cabinet table at Treasury Board informing the budget, just how much pressure there is in the healthcare system. And then secondly, Dave, what's also happening is there's a pressure too on the Premier and the Finance Minister to spend less because the economy is not strong. It is slowing down, international pressures, but also from the political side, a viewpoint among conservative voters that there's been too much overall spending by the Ford government. They did get second rank, by the way, in a recent Fraser Institute survey on fiscal responsibility, right behind Alberta, but they feel that, right? So that is driving these discussions. But I will still say that giant Pac-Man that is a healthcare budget over time is not going to be health that will be reduced. It'll be transportation. It could be education. It could be law and order. It could be transfer municipalities. Governments have tended, whatever stripe, to throw more and more to the healthcare bucket, and it's the other ministries that actually see the cost of that by less consistent investment.
But let me ask you then, based on what you just said, Tim, is, if that's in fact his inside voice out in public in front of that business audience, clearly there's a whole lot of loud conversation going on then behind closed doors on this very subject.
Yeah, absolutely. The pressures from healthcare, and then overall that the revenue will be constrained because of the economic uncertainty. And look, we actually see this in the federal Liberal budget as well, right? Healthcare transfers are increasing, but they are slowing down that rate of increase. That in turn puts pressure on the provinces. But my prediction, I don't think there's a political appetite to go down higher user fees, whether that's for the drug benefit program, whether that's income testing. I don't see that. I don't see an appetite for certainly bringing in more private care aside from private delivery under the public umbrella. We're not at that debate yet. So if I'm the other ministers, I'm actually hearing, what I was dusting off of the budget doesn't have as much of a chance as I thought it did a couple months ago.
John, all of this comes to me as in terms of a revenue issue, in terms of where the money is being spent, obviously. But this is a government that boasts and pats itself on the back for never raising taxes. In fact, cutting taxes, cutting fees, so that the pool of money available is shrinking by their own design. So this kind of it becomes a self-fulfilling prophecy. Of course, it's unsustainable if you're deliberately reducing your revenues.
Well, that is the dilemma for not only this government, but everybody else who's trying to run a government in a political environment where, affordability is the issue and you don't want to do anything with taxes or user fees or anything else. But the problem is that we don't have enough income coming into governments in order to pay for all of this sort of stuff. And even though the comment was made by the minister that the population is flattening, well, take a look underneath that. It's an iceberg. Because you've got the growing and aging population, anywhere between 55 plus over the next 2 decades is going to increase the spending on healthcare by about 40%. And we're not even prepared for that. So, if ever there was a time, and I've been banging the drum on this, if ever there was a time for governments to take a look at this in a very serious way, put together almost a tripartite approach, a tri-party approach to this, where you would sit down and figure out, look, we've got to do something about increasing revenue from the public. Because to Tim's point, I get that it's something that you don't want to politically do, but tell me where we're going to get the money from. Tell me where not only are we going to stop the ravenous appetite of the spend of the healthcare budget against everything else, because I agree with everything you said, Tim, but the question is, what do we do about it? We can't just keep patching it up, because the worst is yet to come. And if we don't start figuring that out right now in terms of whether or not people over the age of 55 should be paying into a copay fund or something like that, then we're going to end up with having not just a patched up jalopy. We will have no car and nowhere to go with it. So I think now is the strategic time to be thinking about this stuff.
Can I just throw this in, because we haven't talked about it for a while, but I'm going to put my former premier's hat on, and I'm sitting around that table, the Council of the Federation, and we're having a conversation with Justin Trudeau in 2015-16. And that conversation is, look, the deal was 50-50. We want 30% and you're paying 22%. So I know all our federal money is going to defense now. And I understand that there are other priorities, but that is still a legitimate conversation to have with the federal government about the contribution to healthcare, which has diminished over time, and we really haven't had a positive response from the federal government through Harper, Trudeau, and I'm assuming Carney, in terms of how do we actually share the costs of healthcare in this country. So, John, if there were a tripartite discussion, I can bet my bottom dollar that would be part of the discussion, is what is the fair division of contribution federally and provincially.
But can I just raise one? I just want to rejoin that, because I agree with that. The question really in my mind, having listened to what he said and having taken a look at British Columbia and their deficit this week, is kind of, this is a discussion not just about healthcare, and it's not just about education, and it's just not about deficits and things like it. It is fundamentally about how governments themselves can be sustainable. I remember reading back in the 1981 timeframe on workers' compensation. It was a big report that came out there. And people said, well, we'll never be able to afford it. And the opening paragraph in it was, well, governments can always afford everything. They just, because they can keep spending as much as they want. We know, of course, that yes, you can do that, but at such an enormous cost. So is not the real issue here about how the short-term political circumstance is causing governments to either spend too much or not enough? And how do you find that Goldilocks middle so that you can actually fund these things in order to move forward? It's not just about healthcare or education. Those are two big things. But it is about the sustainability of government and all those other programs, because it goes back to what Tim says. If we continue this road where there's no extra income coming in, even if we grab something from the federal government, everything else is going to suffer. It's going to be like a Pac-Man. It's going to be eaten up. So we're at a crossroads. We clearly are. Even $1 billion shot on hospital is for operations, not for capital. Like, we're not even talking about that stuff. So is not the question now, how do we generate revenue from the public in some way, shape, or form? Because if you've done away with all those fees and said we're not going to raise taxes and we're just going to go off the economy, and the economy is not growing, where do you get the funds from? Like, how do you find the balance? I think that's the central question to where we're at today.
Well, a part of the speech, though, John, the finance minister was waving the flag saying we've improved our credit rating, and effectively saying we've got more cash at hand because we can borrow more money and we can invest it in the economy. That was part of his speech.
Well, yeah. So let's keep running up the credit card, right? Let's just keep doing that. We're nowhere closer. I mean, if you take a look at the pledges, from every government across the country to sort of say, well, we're going to balance the budget. Well, we keep missing that mark, and we're going to miss it again, and we keep punting it down the road. All you have to do is, I hate to make the analogy, but you look next door to the United States, and the it was said in the same breath this week, the unsustainable amount of money that is being spent on all of this stuff in the United States. There's no way they're ever going to get close to dealing with the debt of that country. We are at a crossroads. There's no question about it. The question is whether there's political will or some way to deal with this, because I know that right now, with the hospitals coming up short with their money, that there's going to be clearly a political backlash from that group, and it'll be well organized and probably involve the doctors too. That's just part of what we're trying to deal with here. It's not the whole of it.
But why is the government looking at only keeping the rate of increase in the healthcare budget to less than 1% when they know the inflation is 6 or 7? What's your biggest cost in the whole system? Staffing. So what are they going to do here to reduce costs is cut staff. And what's going to be the magic solution? Because that's what we need in hospitals, is that they're like a hole in the head, is fewer staff. I mean, we're already treating people in ambulance bays and in hallways for years now. This has been going on. And where are we going with this? If we're going to have fewer staff in the hospitals and in clinics because they get laid off, well, gee, do you think the private sector might be able to be a bit of an answer? I think this is all ideologically driven. I think the core government wants more private clinics, and they're literally driving the hospitals into the ground. They're going to be forced to cut staff. It's all they can do. And then those staff are all of a sudden able to get jobs with better pay and better working conditions, better hours often, in the private clinics that the government is going to pay 2 to 3 times as much for each service that's provided in those clinics. I don't understand why this is, the solution, but it clearly to me is ideologically driven. The Conservatives want more private delivery of healthcare systems. I think to Tim's point, they like actually a private separate system. But I think John has hit the nail on the head. Appropriately is going to be some sort of healthcare premium, maybe for means tested for seniors over the age of 55 or something like that. But there's going to have to be some sort of premium to pay for the cost that's going to hit the hospitals in particular in a very hard way, in a big way, in a very few short number of years. But right now, it seems deliberate to put that budget figure in there at 5 or 7.5 or 0.7%, whatever it was, when he's saying a healthcare funding is unsustainable. That's showing then that you're just going to make it worse. You're going to make the situation worse, even though you're bringing in more revenue. So why is that? Because they want to drive the staff out and drive more private clinics in Ontario. Tim,
you've tangled with the boomers on the panel in the past, and I would expect in this case the boomers are probably to some degree have to bear the brunt of the criticism here, because it's not until the boomers were really in the maw of needing this healthcare system that is under such pressure that we're really banging our fists on the table. We should have been talking about this 35 years ago.
I blame the boomers. It's all your fault. We poor Gen X's are now stuck with a mess. Yeah, look, I don't, Keith. Keith always has great insight, but I do not see this in through an ideological lens. This is not an ideological government. It's conservative, but I think it's far from being ideological. Look, and you know this from your observations, and Premier Wynne and I have experienced it, right? Healthcare extremely sensitive. You don't do something about getting more docs and connecting folks to patients, that is an election, ballot question. If hospitals continue to have overcrowded hallways in the campaign against fixing that. No, this is actually trying to find the best way to allocate resources, and the use of private clinics is actually to give better services, not ideologically driven to screw over hospitals or people who work in them. And I do think when the arm wrestling match, look, the 0.7% increase is actually on top of a higher base, right? The health base went up through COVID. It stayed high. So that 0.7 masks that the health budget actually gone up quite a bit under the government. But I still think around that cabinet table and the arm wrestling takes place between the health minister versus labor or versus transportation or versus community and social services, at the end of the day, that health almost always wins, and it's the other ministries that pay the price.
Let me go back to this. We have in the province of Ontario right now, we have 3 million people who are over the age of 55. 800,000 people in this province who are over the age of 55 have income of more than $100,000 a year. That's including retirees. I am one of those people. I'm very fortunate with how my life has been structured. I am begging for some way in which I can buy an insurance policy for long-term care. Thank you very much. Please provide me with the ability to spend $100 a month, because if I take 700,000 to 800,000 people in this province who are paying $100 a month, and my polling shows that clearly they're willing and able to do so, that's an extra $1 billion a year that can go strictly to that area of our healthcare system. There are people who want to pay taxes. There are people who want to pay surcharges so that they can have what they know they're going to need, and right now they don't have. There's no chance that whatever I gained on my house and is in my bank account when I sell it is just going to be eaten away within the final years of 2 years of my life. So the question is, what role is government going to play in all of this? And we are running out of time. And I think you got to look at means tested things for this. And you got to start making these decisions now, because if you're going to be 10 years out, that's $10 billion that could come from a section of the population who frankly is willing to pay that right now.
Yeah, it looks at when we start talking about this restructuring, Kathleen, of the healthcare system, and Keith talks about private delivery and the private sector involved. We get so bogged down in the private sector, similar to the conversation we had last week around P3s. People, assume, well, because the private sector is involved, the project got screwed up. Well, the government isn't in the business of building buildings or highways or whatever. We need the private sector to be involved. I think, to John's point around this broader conversation, there needs to be a clearer understanding or a reset, a recalibration of where the private sector overlaps with the public sector in healthcare, because we're not going to get anywhere just by standing on each side of the fence and saying yes, no, yes, no.
I've just been listening to the conversation. There's so many ways into this. There's so many factors that come to play, So we brought in under Dalton the Kensington Eye Clinic. So the whole notion of private delivery, to Tim's point, I think is something that we have to acknowledge. Look, my dad was a GP. He was a private deliverer of healthcare, and he was paid on a fee schedule. So it's not like private delivery of healthcare is an unknown thing in this province. Doctors have not traditionally been salaried, so docs have been private deliverers. Anyway, so I think that is something that we need to continue to monitor. But it's part of the system, and it's going to grow. That private delivery, publicly funded. Where we get worried is when it's privately funded. That becomes a problem. but there's so many other things. There's a coordination of care. So when we talk about you get a primary care physician, then what happens if you need a specialist? Well, we have a system that's pretty fractured right now. There isn't a coordinated kind of way of accessing a specialist. It's one-offs and so on. And so we need to make sure that that's a better coordinated process. We've got a whole lot of work to do in terms of the upstream, the people who show up in emergency rooms. Read Danielle Martin's book, Better Now. And, one of her solutions to the challenges in the healthcare system, and she's at Women's College and has worked in the system for years. She says, basic income and poverty reduction. We need to be looking at how we increase those supports so that we have fewer people coming in the first place. She talks about pharmacare, and I know that that's a discussion that seems to have passed. I'm just saying there are a whole lot of things that we need to do. I mean, and Tim, I know you work with the OMA, but when I was premier and we were trying to get a deal with the docs, one of the big internal challenges in the OMA is what we pay specialists who have new technology. That means that their work is very different than it was 30 years ago, but we're paying them more, and we don't pay family docs. So we don't have as many people going into family medicine because they're not going to be paid as well. It's an intricate web of challenges. We have to tackle all these things at once, sadly, but we have to have that coordination of effort. Otherwise, we are just going to continue to see 6, 7, 8% increases in healthcare unless we do these things that actually reduce those pressures. So that may not sound like a short-term fix, but some of those things actually could happen quite quickly. If I think about the coordination of the surgeons, if we started to have lists and you were assigned to surgeons depending on availability for certain procedures, that would change the trajectory of wait times on surgery. Anyway,
if we're going to do everything
have
at
to be
once,
done.
so if we're going to change everything all at once, if it's going to happen that fast, it's the implementation I worry about, how things are done. Yeah. And this, again, the Trillium reported last week on what happened when the Ford government tried to change, and in fact did change, the procurement practices for home care. And they went from 65 providers down to 15, and they were warned that we're not ready for this yet, and they delayed the program to the fall of 2024. But in the end, it ended up creating severe shortages of everything from antibiotics to end-of-life pain medications for people who were literally dying without their pain meds. People were being sent boxes of medications, and inside would be an IOU. We don't have the meds to send right now. This went on. The problem has finally been resolved, but for a year, it was about a nightmare. And the Trillium FOI nurses' notes and doctors' reports from all across the province. This was an issue right across Ontario. The implementation of this, it was to drive efficiencies. The hope was to save $31 million a year. But the procurement bodies that were going to do, agencies that were going to do, were just not ready. And we have the minister blaming the new Ontario Health at Home, it's called. And them themselves, the new agency, blaming the vendors. Whatever the reason is, it was just pushed through too fast. The government rushed this through. And as I say, if we're going to be changing everything to do with the healthcare system, the implementation has to be really, really top of mind, because as we saw with this home care thing, people were literally dying at home without meds to ease their pain and suffering. The children's drugs were left off the formulary, literally left off the list by mistake, and the clinics were running to Toronto Sick Kids Hospital trying to barter some way to get some medications. This was really, really screwed up. Excellent reporting by the Trillium, but a real cautionary note as we move forward with some major, major changes to basically the whole way we deliver healthcare.
But Keith, a lot of those changes that I talked about are in the works. They are being worked on in the ministry, and it's a matter of making those things a priority. I think that there needs to be to John's point, there does need to be a really clear philosophical approach to how we're going to deal with healthcare. And maybe it's a tripartite commission. I don't know. But it's not like nobody in the ministry is thinking about these things. They are. And it's a matter of a minister saying, okay, this is the multifaceted approach that we're going to make in the interim, we're going to continue to increase healthcare by whatever it is, 4%, whatever. I think that's probably where they need to be right now. I think that 0.7 or 0.5% is not realistic, but in the interim, we're going to do this. But here's the suite of things that we're going to do that is actually going to reduce our challenge and reduce the pressures. I think it has to be that kind of really smart, strategic approach. And to the implementation, Keith, I agree with you. Implementation in education and healthcare are always a huge, huge challenge. I would say across government, it's a challenge, but in those ministries particularly. But I think there has to be an intelligent kind of laying out of what the intricacy of the problem is, and then saying, these are the things that we're going to focus on. It can't be a soundbite. It's not like there's one single thing. You can't empty a bottle of Crown Royal and solve this problem. It's not that kind of problem. There's much more complexity to it, and somebody in the government has to be honest about that.
I don't know. I think Crown Royal is pretty good medicine. Dave, can I give you one last point on the Tim Hudak theory of the Pac-Man eating the budgets? Pac-Man, by the way, Boomers, was a video game.
We were there. Yeah, we invented it, buddy.
Yeah, that's right. He said it's going to rot our brains, when in reality, for me, it was Galaga. So I was just doing some quick math here on the side. And since 2020, right, the beginning of COVID, the healthcare budget is actually up 38%. So they have had, on average, significant increases. But Pac-Man theory, compared to every other budget, 20%. And the little, inky ghost that's been gobbled up the most, post-secondary education, funding only up between 5 and 10%. So you can see health continues to take a big part of the budget and growing, everything else less so.
Yeah, but so let me throw it to you, who, being closer to, a conservative government than I ever have, is okay, so that's the case and it's going to continue. And in fact, one could argue it's going to get worse. What would you suggest to the government of Ontario and what they do with this? Like, all right, we know the demographics, we know healthcare, we know Pac-Man, we know all of that sort of stuff. So do we stand still and just let it happen and every year trim the sails, or how does this government approach that?
Probably the way they are, right? Like, you would have to actually start this at the beginning of the mandate, soar up the calories to really take it on, and then demonstrate, 4 years later, the result. You'd have to have federal support as well for any kind of significant change. Otherwise, you try to restructure. Premier Wynne put out some examples she worked on. The government's done some of the similar things on more primary care, better technology in the system. I think the way that they're giving more professions opportunities to deliver primary care as well has been helpful. Look, the fact that our docs have to use, WhatsApp to try to connect people with a specialist, and the costs that imposes on the system on waiting longer, right? But I think, John, the pure politics of the moment, they're probably making the choice that is, having been there and feeling the pain of any kind of healthcare reduction as an MPP, it's probably the path we need to be on for the time being. But I really hope there's a courage to change that for the next mandate.
Well, again, I don't want to monopolize this, but let me throw it back again. I mean, this is a three-peat majority government with no one across the aisle. I mean, if you've got political capital to spend, now is the time to do it, because otherwise you are handing the two opposition parties and potentially the new Liberal leader a golden bucket to move forward and to say, look, this is what's going to happen. No one's addressing it. So would you not sort of say we can begin this process right now because you've got the, you got the coin to do it with?
Yeah.
Thank you very much.
But it's not.
It's been a great day.
You win.
How do you hold the Fed's feet to the fire, though? To the Premier Wynne's point about the federal funding was supposed to be 50-50. And I think it was Paul Martin, wasn't it, that balanced his budget on basically cutting the funding to the provinces. It's going to be hard for the provinces to make that case, because every time we hear a First Minister's meeting until the Trump era, it was all, they're just asking for more healthcare and education funding. It's all we heard about. And of course, the government, the federal government, just basically ignored them. It's come up a little bit, but for the most part, it's supposed to be 50-50, and it's nowhere near that. So if there's some way politically for the premiers to hold the federal government's feet to the fire on healthcare, that would be great. But right now, they've got other issues to deal with, and holding unanimity on the fight with Donald Trump and on the world trade issues, I think, is more important, well, at least more crucial to them on their plate right now, than to have this, to pick another fight with the federal government when right now is not the time to be fighting with the federal government.
Well, maybe if Danielle Martin is successful in her bid for Christy Freeland's seat in the legislature, she might become the next health minister. So she might be a pretty good voice in the House of Commons, right?
Well, she'll sure be talking about what the plan should be, guaranteed.
Clearly,
if she gets there.
And you know what? It would be very difficult to argue with most of what she says. Doesn't matter where you fall on the political spectrum, right?
Yeah, exactly. So I think having somebody like that who actually would have a plan to be able to work from the federal side, because to your point, Keith, what would it take to put pressure on the federal government? I think there'd have to be some kind of consensus across the country. I mean, even this might not work, but I think there would have to be a consensus across the country among the premiers that there's certain things that need to happen. In the wake of the Romano report, in terms of wait times, I mean, there were a number of us, particularly we worked in Ontario, to reduce wait times in particular areas, and so I think there needs to be that kind of coordination of what are the things that we're going to focus on. But it would have to come from more than just one province. It would have to be a coordinated kind of internal campaign to bring that to the federal government. But it would be really helpful to have a champion in the federal government.
We've gone, all the way through and haven't gotten to anything but that topic. But I think it was worth the conversation. But given the nature of the news conferences that the Premier had this week, I thought it was interesting that he showed up and was supposed to be talking about one thing, but clearly ended up talking about other things. And this was sort of typical of that.
Probably going to get in trouble by my team, but I'm going off topic here for a second. I got so many people wanting to go to shopping malls. And Yorkdale would have been packed. Sherway would have been packed. Mississauga Square 1 would have been packed. And I always say everyone deserves a rest, right? Take your holidays. But there are a whole bunch of people that want to get that little extra overtime, getting paid double time and a half. They get their regular statutory 8 hours, and then they get another time and a half for anything that they work. So even if someone's making $20 an hour, now you get to go in and make $50 an hour.
Well, I suppose that's the case, but he reminded me of this guy.
Why are you closed? Tell us why you're closed! Tell us why you're closed!
It's just, he wants to shop. There's no question about it. So the Premier making the comments, after Family Day, and it sounds as if he wanted to go to the hardware store or something to that effect and couldn't get in there. It was a masterclass, Tim, in terms of, I think, distraction, because he was supposed to get up there and talk about other things, but decides that this is the thing that was really ringing people's bell after not being able to go to the mall on Family Day.
You should do a search on this, Dave. I think you're seeing this expression pop up in a lot of media that says, in an unrelated press conference, word said. What was that? 7 or 8 words. They're constantly out there because you had the shopping, the basket weaving, right? That was sort of the spontaneous. And of course, we're taping on Thursday morning. We're going to be showing the gold medal match here at Council Public Affairs for the women's hockey because Premier Ford ordered us to do so. I think that was the message of the day. Look, it works as long as it works. He has very good gut instincts, but why the staff go crazy, and he referenced that, is, there is the risk that if you're talking about all sorts of disassociated issues and not driving a central message, that puts your long-term success at risk. The other thing is people will copy that, and there'll be other ministers that are out talking about this or that, and they'll be crossing about, other topics, other ministries. So there is a risk that when the leader does it, you pretty soon see other ministers following course.
Well, and to your point, one of the things that did come up was the whole issue of education. OSAP was top of mind. I thought it was interesting, after he talked his rant on shopping, he got around to the OSAP.
Right off the hop, I got a lot of calls from students about OSAP, and there were interesting calls. I returned every one with a standard statement, but I wasn't getting hundreds, I was getting thousands. But I get quite a few all the time, and trying to just explain that, or the situation that Ontario was facing wasn't sustainable any longer.
Well, there's that word again, Keith. It's unsustainable. But just by the way, I just wonder if he took those 1,000 calls on his own personal phone.
Absolutely.
Just asking.
I'm sure he did. This was so typical, Doug Ford. I mean, he's almost anachronistic here. He comes out with, stop taking the basket weaving courses, which I'm pretty sure, other than the weavers, they've canceled those many years ago. And study STEM and all this sort of stuff. But it was almost insulting the way he's telling it to the students. I mean, yes, he's fought with them. He had the tuition froze for that long, and that was going to be unsustainable. There's no two ways around it. That's a hard sell to someone who is just going through the post-secondary education system now. They're getting their college and university education, being told that they're not going to get nearly as much eligible for a grant. The loans will have to be paid back, which was always the case, but it's going to be 75% now, or maybe 100% will be loaned, but a max 25% for your grant. That's hurting people, and especially when they look at we were talking about the boomers. Us boomers, we had much cheaper education, post-secondary education, and we also had much better grant and student loan programs, to the point where in the 70s when I was going, it was called the Ontario Stereo Assistance Program, which, that's just, most of us didn't really even need that kind of money. The tuitions were that low. So for young people nowadays to be facing much higher tuitions, to be told they're going to have to pay more of it themselves, it may be unsustainable from the government's point of view to keep that level, to keep the tuition freeze in place and to keep funding for universities so low, but it's not. It's not fair to these young students. The government, how they're going to get around this, I don't know, but they're clearly sticking to their guns. And again, this is another setting us up for the budget that's coming next month. We just can't afford everything. What else is going to be cut? But I think this is something, they're willing to take on the students with a fight. Because they have to. Quite frankly, it wasn't sustainable to keep the tuitions down that low. And we see, Tim pointed out earlier, that the increase in funding for colleges and universities has been the lowest since the pandemic of any of the government budgets. It's barely going up at all. So they're really, really hurting. We know that the change in the student profile that the government's allowing federally and provincially for the foreign students, that's really hurt them as well in the post-secondary education system. So the whole system needs money. And this is the government's way of saying, well, some of it's going to come from the students.
Well, John, the Premier is suggesting that you need to get into the STEM programs and become doctors and nurses and all those things that we really need. And we just finished a conversation saying we can't afford more doctors and nurses based on the way we're budgeting in healthcare. So what we're talking about then are those who are going to go into some of these programs. They're more expensive programs. It's more likely that they are going to have more debt coming out of this. This is just compounding. I mean, we're complaining at our end about the debt we're facing vis-a-vis the deficit around healthcare. 25, 28-year-olds coming out of school with thousands of dollars of debt before they've even got a job. That's significant in terms of a setback economically.
Yeah, I think the Premier said a few things that, are on target. We want a different kind of workforce because of the demands that we have in our society. So workers and frontline people, even HVAC people, are critical nowadays and can earn a lot more money than others. But there's also the other side of the coin, and that is a dental assistant, for instance, is going to rack up over 2 years. I think it is almost $26,000 worth of debt. Tell me how many dental assistants can pay that off even in their lifetime. There's a whole bunch of people that, unless they marry somebody who is an HVAC operator who can do some side jobs, that will be saddled with that sort of stuff. Look, I think, again, what oftentimes gets lost in all of this is because the Premier uses certain phrases that we fixate on, and maybe to the point of saying, look, we're transitioning and we have to focus on these kind of jobs is the bottom line. But the other bottom line for government is clearly, again, how do you fund this? How do you allow someone to take those courses that are vital for our economy and vital for our healthcare system and not have that burden on their back, going forward? I don't know the answer to that, but it's certainly, decreasing OSAP opportunities for a lot of students. Even if you then go into STEM, that's going to put a financial burden on you that you basically can't afford going forward. So again, the whole education system itself, I'm not trying to say that there's another commission that's necessary, but we are at a bit of a crossroads in terms of that, especially even given, the issues that were raised this week with how many of the school boards are being taken over and supervised by others. So the whole education side of it has to be looked at as well.
Well, Kathleen, when the notion that somehow we have to make sure that the students, in terms of their choices, are accountable vis-a-vis the money that's being spent by government, and I get it in terms of, make good choices, etc. But I made this point on the radio earlier this week. Both of my kids studied majors in philosophy, and they are both entrepreneurs, self-employed, and they employ other people. Yeah. So it had nothing to do with what we need in the market in terms of accountability around it. And I will say that there was no OSAP involved. They both got some scholarships, et cetera. But to the point, the effectiveness of their degrees had little or nothing to do with where the money came from.
Right. And for the Premier to be talking about what students are studying and that whole issue of a workforce that's prepared for the jobs that are available, that's one subject. But the issue around supporting kids who otherwise are not going to go to college or university, that's a whole other issue, So distracting with the basket weaving gambit totally takes away from the reality that, yes, the government has allowed universities to increase tuition. That had to happen. They've taken money from OSAP and put it into money that they're going to invest in the system to change the funding formula. So, okay, changing the funding formula, that's a good thing. But the OSAP cuts, it's the worst economic decision that this government could make, And I know this government doesn't think about post-secondary education or education at all in terms of the economy, but it's intimately and intricately related to our economic well-being, And I don't think that this Premier has ever talked about education in that way. And this is a perfect demonstration of a lack of understanding, in my opinion, of what we actually need. So yeah, of course we need people who are technically trained to do the engineering jobs and the science and math jobs. Of course we need that. But we also need people who are critical thinkers. Your kids are a great example of that, Dave. But, there are so many of us who went through arts programs, and not just boomers, but my kids and the next generation who need to be able to think critically and innovate. That is what our strength is in this province. So what this government has done with this cut to OSAP is basically said kids from low income families are not going to have a chance to take part in post-secondary, because what we found when we put our program in place that allowed kids from families that earn $50,000 or less to go to school tuition free, we saw more single moms, we saw more Indigenous kids, and we saw more kids from low-income families. And that was exactly the impact that we were looking for, because there are smart kids in all of those groups who are going to now look at what the debt is going to be at the end of their engineering program and say, well, I can't do that. I'm not going to do that. So we lose that whole population by this very short-sighted decision that this government has made.
Yeah, Tim, the question then becomes, where's the balance? I mean, at some point, we've got to make sure that we're incentivizing to a certain degree to make sure that the kids who are not otherwise able to afford to go to university, college, post-secondary, have that opportunity, and in fact, income is not necessarily the barrier to that education.
There's a little expression that you campaign in poetry and you govern in prose. Premier Ford also governs in poetry, right? So he's trying to get across.
Is that what it's called?
Music, but it's music to my ears.
My
music
God.
to my ears. The point I think he's making here is that since the taxpayers do subsidize post-secondary education considerably, that you have to own part of that, right? That you should have a skin in the game. And if you look, right, I think that for a typical student in post-secondary, universities likely higher than colleges, that the portion of student pays is less than half. It's usually around 4 cents out of 10, 40% of the funds. So your question on balance, I think you're right, Dave. I think we can shift that way. Now, as tuition increases, we had a program under Premier Harris that you had to dedicate, I think, 25% to go to scholarships, to bursaries, to assistance for the lowest income level. But I think that cap for so many years was starving the system. So, in the other extreme, I'm counting the records over Keith Leslie's shoulders, and I'm still at 400 on the first row. So I think the S and OSAP for him definitely was stereo. I'm willing to bet on that one. But I think Premier Ford is simply moving things back towards a more reasonable balance on how much you own versus how much the taxpayers pay for education.
But Tim, what do you say to the kid who is perfectly qualified to go to an engineering program or a medical program, but just is afraid of carrying the debt? A kid who's from a family who no one's gone to university. You know, they're the first in their generation to go to university. And we are all sitting here. The 5 of us are sitting here. We all can afford to support our kids going to post-secondary. We have no idea what it means to see your kid who is talented, who is capable, and is not able to even apply to one of those programs because as a family, we're too afraid of the debt that they're gonna carry. I mean, it's irrelevant which program you're talking about if the kid isn't even going to apply.
Right, but if a upper middle class family is only paying 40% of their child's education, that hurts the low income person as well. Less money going in that could otherwise go into post secondary education. And if part of the tuition increase goes to scholarships, right, that helps with the low income side. I just think if you look at the math, the balance across the system, there is a heavy subsidization for the taxpayer. And I think Premier's moving in the right direction, which would be an investment in the quality of education for all students, including low income.
I don't have any argument with the increase in tuition and the change in the funding formula. I think that's all good. But Tim, that there are scholarships that sit on the shelf, because they're not universally accessible and kids don't know about them. The thing about the OSAP program is that's where all the kids go. That's where they know the kind of universal access happens. And without that being, and you talk about the Harris years, 25%. And when we came in, that was one of the things that needed to change was there was not enough grant in that. It was keeping kids out. Low income kids are half as likely to apply and go to post-secondary than higher income, than affluent kids. So it's just cutting our options in terms of having a strong economy in the future. It's a short-sighted decision, and we're going to pay for it in the long run.
Tim, do you just want to sit quiet?
Yeah, no, I think I made my points, right? It's not on one extreme or the other. And I just think that you're moving the pendulum back to a more responsible balance that we as individuals benefit the most from post-secondary education. Yeah, there is a benefit to society as a whole as well, no doubt. But given that getting a university degree or a college degree or diploma, you're going to have a better economic path. And therefore, you should have a share of investment in that. And you can have that scale move depending on where your family is on the income ladder. But I would argue that pendulum has gone too far to limiting investment, which as a result, we're seeing fewer courses being offered. We're limiting choices. The quality has gone downhill for everybody. I think getting that pendulum back towards the middle is the way we got to go. And I think this is the right track.
All right. Well, let's leave it there for this week. There's other things to get to this afternoon. I've taken out the garbage. I've done the podcast, and now I'm going to sit down and make sure I watch the gold medal hockey game. Thanks to John Wright, Kathleen Wynne, Keith Leslie, Tim Hudak. I'm Dave Trafford. By the way, if you are listening on any one of the podcast apps, make sure you hit subscribe or follow. And the same thing on YouTube. We're picking up a lot of steam on the YouTube channel. If you're just dipping in, by the way, make sure you hit the subscribe button, the follow button on YouTube. And because what will happen is as soon as we post something in the channel, you get a notification, so you'll be up to date on everything that's going on. And we'd love to have your feedback. So the comments that we're getting are great. Some of the stuff we heard back from you guys on the EV discussion was rather vivid. And certainly the discussion we had last week about Tumbler Ridge and the mental health concerns, the issues around media, all of that. generating a good deal of feedback. Just one other thing. This week, we spent time on Now and Next. That's the sit-down politics podcast I do with the comms and strategy team. And we went into some of the conversations around Tumbler Ridge in terms of the comms, the vigil that was held, the remarkable pivot opportunity there for Pierre Poilievre, and will he take advantage of it? So check out Now and Next, wherever you get your podcast. In fact, wherever you get this podcast. It's On the Ledge, your Ontario Politics podcast. I'm Dave Trafford. Go Canada.
Pay no attention to that man behind the curtain.